And I guess that means we'll have a roll call.
Bell,
Here.
Curran,
Here.
Freeling. Present. Harrison,
Here.
Hinkleman. Majerick,
Here.
Martin,
Here.
Scott,
Present.
Falrath,
Here.
Werfel. Here. Yarborough,
Present.
Elliott,
I'm here.
12 present.
Before we approve the minutes, does anyone know the words to happy birthday?
I could,
Maybe we
I
could,
could
we
have
could,
Terry could sing it for us.
we could brush that off, yeah, right?
Yeah,
My grandson, he loves it.
okay.
Yeah.
Well, why don't we see what we can do, and where it says, after happy birthday, comma, insert name, the name is Thaddeus.
Yeah.
So, happy birthday to you. Happy birthday to you. Happy birthday, dear Thaddeus. Happy birthday to you.
Thank you so much.
As noted by email last night, Commissioner Harrison said treats for everyone, and that means you.
They're just upstairs.
Okay, sounds good. Last week's minutes, the
21.
minutes of November 3rd, any changes to those? Hearing none, will
I'll
the,
make a motion.
okay,
Support.
moved by Majerick, supported by Scott. Madam Acting Clerk, will you please, well, actually, we'll just do a roll call. All in favor?
Aye.
All opposed? Minutes are approved. Requisition review, the person wearing several hats today.
Does anyone have any questions about the requisition list?
Okay.
Just, and I was talking with Brian with this.
Mike, please turn your mic on, please. Mr. Thank you.
Sorry. I was just talking with Brian with this earlier and looking at all the engineering fees that we're having. It just seems to me, and I brought it up, that we're too low in hiring for an engineer, and maybe if we increase our salary a little bit, we might be able to get somebody. I just have a hard problem seeing $25,000 for an engineer to paint walls in the jail, to work up a plan to paint walls in the jail, when that can't be done more in-house. And with everything that's going to be coming up with other projects, maybe taken out of the ARPA fund for buildings, everything like that, maybe we need to have some type of construction engineer to be able to alleviate a lot of these funds. Because you could pay somebody 25,000 more than we're doing right now and still save money with just what we're paying right now for just this.
Okay, thank you. Mamie, did you have something? And then Ezra?
I do. What I would like to say, with the finance committee, these are things that we would normally do in-house. And so there is an expense to it when you look at it, if you break it out of the annual budget of each of these different departments. But because we are short with help, I see the book, of the jobs posted. We have decided to evenly or divide between the companies that we do business with anyway, with Whiteman and Abinmarsh. And so those amounts are, if you look in the regular budget, there is a place for that. But we don't have the people to do it, and it would throw us behind in so many things that we need to do. That is
Thank you.
my explanation.
I know this was discussed over a year ago before you sat on the board, so you wouldn't know. The road issues on the engineering, there's always been a line item for that in their budget also, because we have been short engineers at the road department. As far as that goes, that's something that we've done a long while, ever since I've been here. The other thing is that with the engineering, we would have to have a completely different department within the county government in order to have a construction engineer. Now, granted, we are doing some construction now, but I don't think the ways justify the means in hiring a construction engineer for the county when we have Avonmarsh and Whiteman. And we split up the work in between them. Of course, they bid on it. The other interesting thing about it is that when we first could not get anybody to even apply for an engineering position at the road department, I was under the understanding that possibly, like you said, maybe if we increase the pay or something like that for road, to get higher engineers out of the road department. That was my first thought. That thought changed when I personally called Whiteman and I called Avonmarsh, and they are informing me that between the two back then, that they were 6 engineers down and they couldn't hire engineers also. So it isn't just, it's not us, it's engineers. I don't know where they're going, but we're not turning them out of schools. I don't know. But those 2 private companies who definitely pay probably more than we do, also are short engineers, and they can't get them either. So that was what I found out.
Okay,
Okay,
thank you.
I'd like to respond to that briefly.
All right, but let's bear in mind, this is reviewing requisitions to make sure they're accurate for payment. If there's something else, let's do it in other business.
Okay, I will do it in other business because
Okay.
like I say, I don't like the way all this is going on with
We have
our
Dr. Young
requisitions.
here from Kalamazoo. I'd like to get to her presentation, and we can come back to that in other business if that's all right. Because we'll have other business toward the end of this session, and then, of course, at 10:30, we'll have other business. We need to talk about the fuel purchase process. There was a hiccup last week. Do you want to do that, or Annette?
We can tag team it. We've notified the board via several emails that last week we opened bids at the finance committee. Later in the morning, we realized that a second bid had arrived. And it is 100% the mistake of the county. We spent the better part of 2 days trying to figure out the best way to split the baby. There is no way to split the baby. We made a mistake. We've notified both fuel vendors that the simplest and most transparent way to address it is to reopen bids. So both firms have been notified of our intent. At today's 9:15 finance meeting, we'll be asking you all to do what you did last week, which is to open bids. We'll then bring forward an authorizing resolution to the full board today. It's an unfortunate circumstance, but it was a mistake. And without a doubt, we're not pleased, but we also know that it's still the right thing to do to secure a multi-month contract for fuel purchasing.
Mac, do we need to do something with last week's resolution?
It's built into your resolution.
Okay,
The authorizing resolution today acknowledges last week. It acknowledges that we're striking last week's action. Yes.
Anything to add?
Yeah, just, we actually sent the bid back out to all 5 of the vendors, so they all have an opportunity to bid again. Thaddeus noted to me last night that the resolution actually says the lowest bid. It's a possibility that that may not be the case. I totally overlooked that whole part based on how it comes out of finance. So other than the blanks that you see, it is a possibility that we may need to change that based on what finance does today. But I'm not in PHSC today. I'll be able to sit in on the bid opening and right away get this done and get this down to admin so you guys can have it. Okay.
Questions about that? All right, let's move into the next segment then. We have a presentation from the medical school at Western Michigan University pertaining to people who don't respond when they receive a questionnaire about how did you like your doctor? And
I've never been introduced like that before. I appreciate that. for the non-responsive members of the community.
Yes. They're
The
never
ultimate.
dissatisfied, though. We know that.
No,
So,
sometimes their families are, but they're not. So,
well, good morning.
good morning. So I'm the medical examiner for Berrien County, and I've been the medical examiner since 2019. So we're kind of, it's actually a 4-year appointment, and we're kind of in the end of that. And I believe we're working through the process to continue this relationship with Berrien County. I'm the medical examiner for 13 counties. Most of them are in Southwest Michigan, but we actually skip up and have a few others: Muskegon, Mason, Osceola, Grand Traverse, and Leelanau. So it's not contiguous, and it's always up to the county and the county commissioner to choose what's best for their community. And so, so if you're newer, are there people that are newer to the board? There, okay. So the medical examiner, oftentimes we're thought of as just the place where autopsies are done, but it's actually a little bit more involved than that. We get, not every death that occurs in the county is reported to us, thankfully, but there are certain deaths that are required to be reported to us by law, by Michigan statute. When that occurs, we have investigators. Even though we cover a big footprint, we have local investigators that respond to the scene. And actually, Berrien County has the distinction of having the most investigators that are certified by the American Board of Medical Legal Death Investigators. That was something that just came out the other day, and it's a certification that we fund the investigators to do, and it kind of ups the quality of the investigation and the interactions with the families and other members of the community. So we have, so when a death occurs that is reported to us, in most cases, we send an investigator out to that scene. They gather information. They report that back to the physician who's on call, who's a forensic pathologist, and that pathologist then makes, and you know, a lot of times we have standard criteria for when we're going to do a postmortem exam. But if there's, especially before anybody gets released directly to the funeral home, a call is made to the pathologist, and that decision is made then to make sure there's no other concerns. So we, with that, then if a postmortem exam is needed, an autopsy, then it comes to Kalamazoo for that. And so we arrange the transport. We use local transporters, local funeral directors to do the transport. That's kind of another one of those other things that varies by county on how transport's handled. The other piece that we have is we authorize cremation permits. Anytime before someone is cremated, the statutes require that a brief review of the death is done by the medical examiner's office, and then if those can also be authorized. Other participation we have in the community, every county in the state has a child death review team. So for all pediatric deaths, we are involved in the review team for that. The focus of that isn't to assign blame or it's more like what can be done in the local community as well as statewide and nationwide to prevent the deaths of children. And we received a grant about a year and a half ago to initiate elder death review teams in multiple counties. We chose our most heavily populated counties, and Berrien is one of those. And so we have a pretty active elder death review team. The grant was renewed. We'll continue that. And you might think, well, you know, like people are old, they die, right? But it's also just making sure that the care of the elderly is adequate, and we look for abuse and neglect and other things that you know, would have contributed to that death. And just making sure, you know, some of the times we identify things like, you know, that the communities, do you want me to get that? All right, okay. I might forget your name now, but okay. If you ask a question, I would go, all right. But so in the elder death review team, that's something that we have, you know, we have law enforcement on that, the prosecutors there, adult protective services, as well as the the area agency on aging, members from public health. So people that would be participants in that, and looking for, you know, sometimes we get participation from the state, from Lara, because oftentimes if there's poor care being provided at a care facility that's licensed, we're watching to make sure that if injuries or poor care contributed to the death, that should have been reported to the state. Wasn't reported. Sometimes we find it's not been reported, and then Lara initiates an investigation and And so it's, so we try to stay pretty involved with our counties and with our communities. So that's the kind of an overview of the medical examiner's office. I will say in 2021, 2022, we did get hit pretty hard with the Great Resignation. We should have 7 pathologists. We dropped to 3 for a while there, as well as staff members. We're back up there to 7 now. Which is really nice, but we had a few people move away. Just there's a nationwide shortage of forensic pathologists, and so it's pretty easy to find jobs. And there's sort of this bidding process that goes on nationwide, and so if they move around, but hopefully we have a good solid group that'll stay around for a while now. So we, like I mentioned, we did manage to get back, and I knock on wood that we're fully staffed and we'll stay that way. When our staffing levels drop off, things that happen that aren't great for the community, it's more, as it's not like the pediatrician's office where if somebody calls to make an appointment, you could say, well, let's have that well child visit a couple weeks from now. For us, our patients just show up when they die, the ones that come in. And, sort of our axiom is we're not going to cut our quality at all, but what happens is your turnaround times for reports and death certificates and that type of thing gets more prolonged, and that's harder on the families and the people that are waiting for that information, but mostly the families who need that for, insurance purposes and other things like that, and just for the answers and the closure. But right now things are moving along pretty smoothly. For Berrien County, that total number of deaths, and you'll see that in the report, all the counties that we serve are in here, and we do that because everybody always wants to know, well, okay, this is what's happening here, but what's happening over in, what's happening up in Muskegon, and what's happening over in Calhoun, or what's happening in other counties that are similar in population. And so that's why we put all those in one report. And you can see like there has been since 2019 just an increase in the total number of deaths. The biggest increase was from 19 to 20. It still went up from 20 to 21. And that's just how many people died in this county. And obviously when there are increased deaths, we get more deaths reported to us, more deaths investigated, more scene investigations. So it's those numbers, I'm hoping we'll see that level off and maybe drop back down to kind of pre-pandemic levels. And I think there were a lot of reasons why that was occurring. Just people not going to get care that they should have received it, and so it was kind of. But I'm hoping as we move forward, that those numbers start to drop back down. One of the biggest you can look through there and see once kind of what happens. But if you look, about 30% of the deaths that occur in the county get reported to us. About 90% of those actually we investigate. Sometimes we get a call and we just say that we're going to decline jurisdiction. Maybe it's a hospital calling because they might have a hospital policy that they report every death that occurs within 24 hours. Well, it may be somebody that's clearly a natural death that didn't need to be reported to us, so we'll decline that. So. But then we had, about 90% of the cases that were reported to us or that we investigated, we had seen investigators for those. Only about, of all the deaths that we investigate, about 30% of them do come in for some kind of postmortem exam, or they just come in for storage because there's no family to claim them. And sometimes we can't find family. Other times the family doesn't have financial means to claim them. And other times it's just an estranged family member and nobody wants anything to do with that person any longer, and they don't want to spend any money on them, and that's their right. So we did have, a total of sort of 17 unclaimed investigations. With that, then we apply to the state for funds, and as long as they're identified, they end up if they're not a veteran, if they're a veteran, they'll get a veteran's burial, and we work with the VA for that. Otherwise they'll be cremated, and we have a ceremony every year for the unclaimed cremated individuals. So kind of, you can kind of look through this, probably the biggest, if there is the biggest story, it's that we still have a very high number of drug-related deaths, and most of those are opioids. And it's, the opioids, when I say that, they're largely, these are not prescription drugs. These are largely illicitly produced opioids. Most of it's fentanyl. And so we see still a high number of fentanyl-related fatalities. These are they'll come in with a history of heroin use, but we don't find heroin. Sometimes we'll find a little bit of heroin, but it's mostly fentanyl that we're seeing. Whereas also I thought was interesting in Berrien, a kind of a big surge in falls. And those are usually elderly people. And that's something that we're, kind of studying as well. Like, why are we seeing an increase? So somebody falls and they, suffer, they're elderly and they suffer a head injury and they die from that. So we're seeing that more than doubled from 20 to 21. And so it's kind of, it's very hard to, one of the things I've learned through our elder death review teams, and we have a geriatrician, he said, that elderly people fall. And I think with our aging population as well, that, we'll continue to see that. It's really hard to get people to stop falling unless you're constantly holding them up, which that seems not reasonable. And they don't like it either. So, but it is kind of one of those other factors. So, and then, you can actually go through and, like I said to someone, and you could take this copy home, and if you're having trouble sleeping at night, get it out. But there's numbers in the back too that allow you to compare to other counties and look at, like I think Berrien, Calhoun, and Muskegon are all kind of you're right in the middle between Calhoun and Muskegon population wise, and looking at those numbers as well to see where you lie with how many deaths are occurring and how many deaths are reported, and what people are dying from in those counties. So that's sort of where we are right now. Do you have questions about our office or about that?
Yes, ma'am.
You mentioned that you have a grant for the elderly. Yes. Team. How do we?
Sorry, I didn't know what that meant. Dave, come on, we help each other.
I'm sorry. Geez, I feel like I've been home.
Good. I'm sorry. The grant for the elderly, and how does the child death investigation team, how is that funded?
That one is, it's actually required in state statutes. But so the health department here has a coordinator that manages that. We just all participate, people sort of voluntarily. And even with the elder death, the funding for it comes to, we have a coordinator that, that funds that person to review the deaths and gather the information and put the meetings together for multiple counties. So it's funded. So I guess you would say it's really funded through the health department if there's somebody's time that's being taken for that. So, yeah, so that's sort of it. Mm-hmm.
Jim.
Good morning.
Good morning.
I'm just curious, you've got statistics here for 19, 20, and 21. How did your office get involved in the COVID deaths, the reporting of the COVID deaths? Did your office look at any of those, or were they handled by the hospital and the death certificates went that way?
Right.
Is it one of those situations where your office really didn't get involved in that?
We were not so in the state of Michigan, that was not, the medical examiners were not. I mean, that doesn't mean that we didn't have deaths reported to us that were COVID related. We did look at them, we would get, we would see them. We actually saw them more on cremation permits that were coming through, that it was on the death certificate from the person's personal physician, their PCP. But and it varied by jurisdiction. It varied by, so if you were in, say, Cook County down in Chicago, their medical examiner's office was required to review every single COVID related fatality. We were not.
Okay. Could I follow a question?
Yes, sir.
Are those death certificates filed somewhere with the state, and some agency does oversee all that?
Right.
Or
So
are they just filed and that's it?
Right. Well, they get filed by when a death certificate gets filed and if the county clerk is here, correct me, but it goes first to the county, then it actually goes to the state vital statistics, and they have them, and then it eventually makes its way to the federal government. My understanding of how the state was tabulating those was that if someone had a natural death and a positive COVID, initially, somebody had a natural death and a positive COVID test within 30 days before that, they were classifying it as a COVID-related fatality. Which meant that, if you got hit by a bus, even if you had a COVID-related death, you may have, you wouldn't have related, they wouldn't have counted that. So it was, I thought it was an interesting way because there were some people that, they were certainly missing some, there were some people that would have died and may have had a positive COVID, but never were tested. Or maybe after a while, everybody shifted to home testing. Well, you home test if you have, if you had a positive, you're not calling the state to tell them
But
necessarily.
your office didn't get involved in
No,
that?
we didn't. No,
Okay,
we
thank
did
you,
not.
doctor.
That would have been the really short answer, right?
As you know, that went into the Department of Public Health. And it was an interesting process. I mean, you could have a pulmonary embolism and have a positive test a month earlier and you died of COVID, according to them. So anyway, any other questions for Dr. DeYoung? Yes, sir.
Yeah, I was talking to Commissioner Scott, and he mentioned, and I'm confused on it, on where the person dies. Is that, do we mark that from the death certificate? Who marks it if, say they die in Niles and they send them to Dowagiac because they're in Cass County where the accident happens, and they die in the ambulance on the way to Dowagiac Hospital. Are they now dead, passed in Cass County?
Yes. Where they are pronounced dead is where it, and which is why sometimes the counties that have a large medical center have inflated numbers because people get in the ambulance or get in their personal cars and they drive there for, and that's wherever the death occurs. So the state reporting shows it as where their residence was. They kind of, so, how many residents from this county died. But for us, we're required to handle whatever death happens within the borders.
So that's going to be, you use it based on the death certificate.
What, right,
Or-
we complete the death certificate. We enter that information, but it's
okay.
reported to us. If they died over in Cass County, it's going to be a Cass County case.
Okay.
Anyone else? All right, well, thank you so much for making the drive. We look forward to continuing with you. It is.
Mr. Chair.
Sir.
So the admin committee's been briefed a couple of times on the status of the WMed contract. I just want to take a minute and make sure everyone is clear. The board will be asked to take a couple of actions. November, December, we'll be working to bring forward an authorizing resolution to extend for 90 days to continue working with WMed. Our agreement with WMed will expire at the end of the calendar year. We're taking the 90 days to just grant some more time to work with Dr. DeYoung as well as some of our staff on just massaging the contract. Our intent then is early part of 2023 to bring forward a multi-year agreement. We have had multiple Zoom meetings between our health department, our prosecutor's office, our sheriff's office, and the team at WMed. So no problems. We're just working to secure a little bit more time while we work to massage some of the language.
So we're doing an interim to maintain status quo.
Yep.
Corporate counsel, you're good with all that?
Yes.
And then you'll assist in the prep of the new document starting in calendar year 23.
That's right. Yep.
Okay. All right. In light of that, any questions? Thanks again, Dr. DeYoung.
All right, thank you.
You too. Public comments. Anyone have any? Given the length of that line, I would say no. Other business, Jim, did you want to say anything more?
Yeah, just a little bit more, since Ezra brought up about the road commission. And I don't know, to me, it just seems like since the time I've been here, I looked at all the engineering money we spent for the road commission. And that comes to almost $550,000. And once again, I just think that, we need to try something in this county to try to get this done in-house, because that's not including the 5 months that I wasn't here. And maybe trying, offering a higher wage to where we can get in-house engineers, because even if we hire 3 of them at, 25% more than what we're offering now, we're still gonna save over $250,000. I think that's more fiscal prudent to look at that aspect to try, I mean, we try other things like we're trying with this fuel thing, to lock in a price. Why can't we try things with wages to see if we can get some engineers in here to solve this problem that we're having with high engineering costs?
Okay, very good. Does anyone else have anything under other business?
Does he know where the money comes from for transportation?
No other business?
Okay.
I think we'll break about 8 minutes early and then we'll be back here at 10:30.